What if you suddenly woke up in the middle of surgery? That sounds like the beginning of a horror movie. You are lying on an operating table. You hear people talking. You hear machines beeping. You realize the surgery is still going on. And then you discover something even worse. You can't move. Now, before you start canceling every surgery you've ever planned, let me reassure you. This is a real phenomenon called anesthesia awareness, but it's also extremely rare. It happens in roughly 1 to 2 cases out of every 1,000 surgeries. And here is the part most people don't know: waking up does not automatically mean feeling pain. During surgery, anesthesiologists aren't just sitting in a corner scrolling through social media. We are constantly monitoring blood pressure, heart rate, breathing, oxygen levels, anesthetic concentrations, and in some cases even brain activity itself. Our entire job is to make sure you are exactly where you need to be: unconscious, comfortable, and safe. If any signs suggest a patient may be becoming more aware than expected, we usually catch it long before they fully wake up. But let's say it happens anyway. What do we do first? The anesthesia team immediately alerts the surgical team. Then we deepen anesthesia, often using fast-acting medications such as propofol. Additional pain medication may be given if necessary. And in some situations, we use medications that interfere with memory formation. In other words, even if your brain briefly becomes aware of what's happening around you, there's a good chance you won't remember any of it afterward. Think of it like waking up from a strange dream. You know something happened. Maybe you remember a sound, a voice, or a vague sensation, but the details fade away surprisingly fast. Afterward, we investigate the cause. Was the anesthetic dose insufficient? Was there a problem with line? Did a piece of equipment malfunction? Every possibility gets checked. And here is something important. Movies make anesthesia awareness look dramatic. The patient suddenly opens their eyes, sees everything, feels everything, and suffers through the entire operation. Real life is usually much less dramatic. Most reported cases involve fragmented memories, vague sensations, or dream-like experiences rather than clear, detailed recollections. So, if you were worried about waking up during surgery, the good news is this: it's rare. It's something anesthesiologists are specifically trained to recognize and manage. And if it does happen, for most patients, it's much closer to a strange dream than the nightmare people imagine. Although, to be fair, if I woke up and heard surgeons debating what to order for lunch while operating on me, I'd probably want to forget that memory too.